Ladies and gentlemen, welcome to our panel discussion about how AI accelerating healthcare in a highly regulated industry. Today we will delve on the transformative potential of AI in this area, this segment that is the healthcare, and I'm here with very experienced panelists from multiple angles, from multiple areas. We have the startup voice, we have the hospital and clinical world, the regulatory, and the global service provider plus other experience. And the fifth one, it's actually us. It's actually you, because we are all patients and we're all facing the impact of AI even today. Let's imagine, it could happen. You go to the physician and an AI system is screening your data, it's analyzing your symptom, is looking to your diagnostic test, and is providing a suggestion to the physician. It's not live fiction, is happening today. Like in the area of the cancer screening or the mammography, that can reduce by 25% the false positive. In the area of also cancer screening in relation to the diagnostic part, reading tissues. That's really what's happening today. And this is what we are going to talk with some example and also insight and a barrier in the healthcare system in relation to the use of AI. I don't want to spend too much time. I like to speak, so I need to control myself. And let's start with the first question. And I will address to Bram from the clinical side. I was reading a very interesting survey to 2,800 clinicians. And it's mentioning that 56% of them, they're thinking that they would use AI in the next 10 years. 56%. What do you think, Bram? It's a number that resonates to you? What do you think about that?
Well, the simple answer is we're already using it. So 44% is wrong. But what you could also talk about is the scale that we're using it now, which is probably covering less than, let's say, 1% of all the work done in a hospital. But the unpredictability of how fast technology will suddenly then move forward. And I think with the advent of GPT, LLMs, that we've been working on trying to implement AI in hospital for the last 10 years. But this has speeded up the notion inside the hospital, also the hospital management, that this is now an important topic. So I guess that going from 1% after 10 years to 50% could not take another 55 years or so, but maybe only 3 or 5.
That's encouraging and interesting to see the implementation about that. So the second question would be, how has AI improved patient outcome and operational efficiency in your hospital?
So I can pick up on your example of mammography, so breast cancer, diagnosis and screening. There we have an AI system that actually checks for the quality. So there are 5 or 6 quality marks of an X-ray. If they are not fulfilled, the chance that you miss cancer are higher. So we have a system that basically checks for these quality marks and gives you back a response saying like, look, you missed this or that mark, so that we can repeat the exam while the patient is still there. So this is a very tangible example of, let's say, quality improvement. And then maybe, so for high throughput, we have algorithms that scan large volumes like CTs for abnormalities. So they're not doing diagnosis, but they're saying like, hey, look here, look there, for a bleed, for a fracture. So that's basically from an emergency department to a radiology department. So in imaging, there are quite a few things already ongoing. And what is now coming is basically looking at large-scale information. Basically the thing you were talking about, like screening for information, and especially putting decisions against guidelines. So that really, if we know a lot of things about a patient, that we suggest guideline-conform decision-making for the next physician, which is a huge topic, because the guidelines are changing they are difficult and to memorize, and like this we can quickly become more adaptive to guideline work.
Huge impact, I guess also huge work, right? And in our previous discussion in the last days, you mentioned something that was really, I found particularly interesting. So the point of having the skill gaps, and also the other point was the over-enthusiasm. Can you elaborate about that?
Yeah, so we are basically confronted with under and over enthusiasm, and it's both bad. So under enthusiasm from not knowing what systems can do, and then basically we're talking for years, even after we've done proof of concepts, to get properly financed, because the hospital thinks still the only business it has is, well, looking at patients in a traditional way, and introducing technology is not the business of the hospital, which I think is a mistake. So that's under enthusiasm by not understanding how much new technology could change the work. And the over enthusiasm is just the opposite of the same. It's like people reading the next hyped paper and ask me why we cannot do it tomorrow, right? And then if we don't do it, they will just use the ChatGPT and violate probably a lot of laws, right? So that's the other side of it, and to kind of balance that is really a difficult act. But I think we can manage if we show progress with every step of the way. So that the over-enthusiasts see that we're not doing nothing, and the under-enthusiasts see that it's actually really important.
It resonates very much to me, also the technical, the approach of the clinical work to the technical part. And in that part, I would like also to now focus on Chris, the startup point of view, and ask what unique challenges do startups face while integrating AI into the healthcare solution?
Yeah, there are of course a few challenges, especially as a startup in healthcare. So, of course, one of the most important ones is regulatory, but this is not only in relation to AI, which is integrated into a solution for healthcare. So if you offer something, a service or solution in healthcare, you always need to understand how it fits into the medical devices regulation. So you need to decide on an intended purpose, but I guess Barbara will detail on that a bit further. But this is really independent already from AI, and but of course with AI solutions there are further regulatory aspects to met, like GDPR or the EU AI Act. But apart from the regulatory aspect, you also face some challenges with the quality of data. So you need data to train your models, and to get the data which is labeled, it's quite costly, because you typically need experts to label the image data or other data fragments. And you need to gain trust. You need to gain trust from healthcare professionals, from institutions. So you need to validate your models, your solutions. You need to prove. You maybe need to go through a study to prove its efficacy. And lastly, it's hard to scale in healthcare. So you have long sales cycles. So it's yeah, an additional challenge if you made it that far.
Long sales cycle. Yeah, that's totally true. I'm living the same situation from my side. I'm sure that you have overcome this challenging. Would you like to tell the story of the AI-driven technology that you are applying in your solution?
Sure. At least some of them we overcame over the last years. We actually started to bring AI into our products with an InnoSwiss project about 2 years ago. It started, and in a collaboration with the University of Geneva, and the goal of the project was, we recently completed it this summer, to offer a clinical decision support for wound care, so that non-experts can benefit from the treatment suggestions. And with this project, we split it into multiple models, so to have also a pipeline of features to introduce them into our product. And in the meantime, we have at least, since the project completed, already some of the functionality in our product, and further features like the clinical decision support is in the pipeline for next year, because it requires further validation, and that's really part of it. So some parts we are already able to complete.
Long time of development, long time of sales, quite a challenging environment, but now let's talk about the point of view of the global service provider, Filippo. So, in your point of view, how AI can be used to scale healthcare solution globally?
Sure, thanks, Alessandro. So, Chris, you were saying that scaling is challenging. I would first say it's important to distinguish between clinical and operational purpose. Okay, if we look operationally, right, GenAI, the AI technology behind ChatGPT, very famous now, is already spread from a corporate but also healthcare provider perspective. Think, for instance, the streamlining of information retrieval or the literature analysis that are both important in accelerating several clinical trial stages. Even after the launch of a product, of a medical device, or a medication, still, you can automate the complaint handling, managing the corrective and preventive actions. Those are all applications that are already being used on a large scale. However, from the clinical perspective, there we talk more about discovery, enhancing accuracy, for instance, through machine learning models and algorithms. Well, there the situation is a bit different, right? We have automated dosage, medication dosages, we have early detection of diseases, risk stratification, or even AI can be used for guiding robotics in a surgical intervention. So as you can imagine, those use cases are a little more complex than the one I mentioned before. Therefore, the regulations are more stringent, and the regulations are still being shaped. So they're not yet business friendly necessarily. And this, of course, is delaying the adoption.
So many possibility, and what is going back on the focus? What is the focus of the technology right now in your area as a service provider, of course, to improve the healthcare?
Sure. Well, I would say that in the last decade there have been lots of advancements. However, when we talk about leveraging data for healthcare, AI-enabled use cases for healthcare, there are still complexities. Chris, again, you were saying data quality. Yes, there are some challenges there, but to me, the main problem is actually on locating the data you need, securing the access, so having the permission to use those data. So this morning, this topic was touched several times, and integrating various data sources that are very different from each other. So in this sense, there is a number of things that can be done. Some I would mention is small language models, so you can use less data to still, for instance, having tailored clinical decision support for a primary care center, for a hospital, just using the data they own and maybe some public data. If you're talking about training an algorithm for recognizing diseases, symptoms, you can use synthetic data. So those are simulated, realistic data sets that can guarantee the variety and the diversity of the data without compromising the data privacy. And then regarding different sources of data, well, IoT platforms, probably everybody heard about those. They're quite mature technology. You can use those to enable the exchange of data between smart patient and consumer devices, and many of those are wearing one, maybe right now. Hospital and primary care systems, even suppliers' ERPs. So why is this important? Because then you can integrate the remote patient monitoring into the hospital processes and then enable a preventive home care service. Or you can optimize the supply chain, which means avoiding shortages of vaccines, of medications in a time of crisis, and at the same time not letting those medication and vaccines expire in storage.
We lived that during COVID time, isn't it? Was quite a difficult period for that area in particular. Now I would like to move to the regulatory side. Extremely important. It was already mentioned by Chris, also the impact that can have. Barbara, can you provide a little bit of insight about the ethical impact of AI in such work?
Yes, I think first of all we have to ask ourselves, why do we have regulation in healthcare? And the main reason for why we have such a hard regulation in healthcare is that we want to ensure patient safety. Patient safety is central for why we have such a highly regulated healthcare industry. And within that, I see two topics that are mostly important. First of all, of course, we have data privacy. Medical data is highly sensitive personal data, so who is even willing to give their own medical data for, let's say, research, to develop a new drug, to develop new diagnosis, treatments, or whatever. And how can a healthcare provider ensure that my medical data is safe when they automate the invoicing process or automate other operational tasks? And the other major topic that is highly regulated, or why we have the regulation, is responsibility and liability. Who is responsible for diagnosing a patient? Who is liable if that diagnosis is wrong? Who is allowed to treat a patient? Is an AI really allowed to treat a patient? And who will be liable? Is it the AI or is it the doctor?
It's very important to highlight. The other aspect is in relation to the current regulation could affect also the speed, right? And the manner in which AI is implemented in the healthcare setting. Is that correct, right?
Oh, that's absolutely correct. Again, with data privacy, because medical data is highly sensitive, you have these guardrails, and if you want to use medical data or in any form, you have to ensure that those guardrails are guaranteed. So it takes much longer if you want to do it. As I said, human research, for example, it takes much longer if you want to make use of that data. But also for regulation in treatment, not anyone can treat a patient. I mean, if you want to be a doctor, you need to have a license, which is probably a very good thing. You don't want to get treated by me or someone else. So you need to get licensed, but once you get licensed, you also have to apply the standard code of care. And when AI is not the standard code of care, you as a physician risk liability if you apply it. So you are probably or most likely cautious to apply it, which again makes it slower that AI gets into everyday practice. And also, as Chris mentioned, if you want to get a medical device, sell a medical device as an AI, you need to have prior authorization from the regulatory body. Now that by itself, even if AI is not in the game, is a very long process, but think about this: if you are on a medical device regulatory body and you have no clue how AI works, it will take you even longer to approve that AI. So I think that's one major point where if you develop an AI medical tool is where you can actually have an impact. If you try to educate that body, if you try to talk to the regulatory authority and make them comprehend how your AI works, you might be able to speed up the process, but in the end, it's still a very long process, yeah.
I would like to move towards the future. I'm watching you, Filippo. So what are the most promising AI applications that you see in the sector that can disrupt the way of working or improve?
Okay, I would pick two. Early detection of diseases and chronic disease management. mainly because of the anticipated changes for AI-specific regulations coming in the next few years, and also very important, the digital health reimbursement policies. Those two things can, in my opinion, move those two areas quite well. So if you look at the chronic disease management, AI is promising because it can empower the patient, the consumer, the caregiver, the relatives of the patient to be in control of the disease. This is not just understanding the disease and the therapy, it means also taking action, like personalizing diets, physical activities, the medication schedule, the medication dosage. On the early detection side, well, there are two impacts at two levels. One is local, so of course, house doctors, home care services. Being able to recognize a disease at an early stage means having a treatment that usually is more effective, but also ruling out conditions, right? And then you avoid unnecessary hospital referrals. In many cases, you go to the hospital for nothing, but the GP, the doctor told you, so of course you do that. And the macro level is about enhancing the screening campaigns. Because by a better stratification and interpretation of population data, you can have those targeted policies, targeted programs, and you can secure that the high-risk individuals are getting checked early and frequently enough.
We know that the healthcare system has less and less budget compared to the population. We know that it's quite a big burden. Maybe not in Switzerland, but worldwide. I don't know, maybe you have some comment about it. But in general, what do you think the solution that you mentioned, they can also help and improve the treatment and also reduce the healthcare cost? Because this, I think, is the great challenge.
Sure, but I was a bit laughing because if you think how much the premium of several insurances is increasing in the last few years, the percentage, it shows there is something not working here. So I already mentioned an example of the impact, right? Reducing the necessary referrals, that's one example. But also with the targeted screening campaigns, those are very cost effective because you have less people that needs to be screened. And on the long term, of course, a healthy population is less expensive than a sick one. When we look at the early detection side, on the chronic disease management side, a patient that can take care of his own disease at home can reduce complications, can reduce hospitalizations. Those are all factors that are very costly for us at the healthcare level. So in general, I would say that many use cases, they are supporting an AI-assisted decentralization of the healthcare services. Of course, it also goes through digitization. And in general, they are reducing the burden, as you were saying, of the cost, while maintaining or even improving the quality of care and the quality of life of the patients. So they are in this way addressing a much bigger and actual topic, which is the healthcare sustainability.
We listen how the regulation can impact in the speed, in the effectiveness of the solution. How do you see the future of this? Do you see any trend? Barbara, any future?
Well, you're asking me if the AI doctor is going to be live next year, right?
Maybe as a hologram in front of you.
No, I do not see the AI doctor being in place in the next, let's say, decade, but we're definitely moving towards the trend. But if you keep in mind that today, by the healthcare code of the Canton of Zurich, a physician has to provide healthcare one-on-one to the patient. So that's the standard of care right now. So moving that to an AI doctor within 10 years would be very ambitious. But I definitely see a lot of change getting there, like as we said, with operational tasks that can be outsourced to AI. Those are low-hanging fruits that are definitely coming, that are already in place right now. Bram mentioned that we already have a lot of AI going on as kind of let's say, study buddy, a co-pilot, a wingman to the physician. The physician is still responsible and liable, but he has that AI that can help diagnose, that can help treat, and we are definitely getting there. and there's lots of science going on right now. I mean, the FDA approved by this summer, I think, about 1,000 medical devices, AI-based medical devices already. The EU has some less, and Switzerland has practically none, but we adopt those of the EU, and it's getting there.
That's encouraging. Honestly speaking, I would hope to be never treated by an AI directly. I think the human part should stay there always, also for the emotional part that is very important in the clinical world. Do you see any, in this trend, in this future scenario, do you see risk or benefit? Do you visualize something that can resonate coming from the regulatory, coming from the law in this context?
Well, I mean, the benefits would definitely be what we're all promised by AI, that we get faster, more precise, and more patient-tailored healthcare, meaning that we have a much better health outcome for every patient. And if we do not adopt the regulation that will allow to get AI involved, we miss out on an opportunity to get those results, right? But on the other hand, if we go too fast, if we approve AI without really do the scrutiny work that we already do for other parts of healthcare regulation, then we risk that we implement it too fast. And in that case, if an error occurs, patients might be discouraged, they might mistrust AI. So I think the regulator has a really hard choice to make, like, do it fast enough so we can benefit from the advantages, but don't do it too fast so you can still ensure, as I said, patient safety as the main overarching goal of healthcare regulation.
Yes, talking about this promising innovation, Chris, what do you think, coming from the startup world in relation to AI, could be a disrupting innovation from your point of view?
Yeah, actually, I see it quite similar, like Filippo in the field of prevention or management of chronic disease. I think there is a good, really interesting potential to avoid hospitalizations. If early on, for instance, like with Imito, we are in wound management. If you can detect with a patient who has diabetes, that there is a wound which gets infected, you can avoid amputations if it's early enough detected. And so this is definitely one area which I think is quite interesting, and where I guess will some solutions pop up. And then as well, remote monitoring. I think with the amount of data which is collected with variables, and we all have, or a lot of people are wearing, to generate insights from these variables and to offer them in dashboards for clinicians, etc. That's super interesting as well. But on a practical side, I also see it quite important to use, and it was mentioned by IBM today as well, to have it locally available or even on the edge, and that's what we do, for instance, with our models. We allow them to run directly on the smartphone so that we don't have a risk that data privacy is violated, and these are the areas I think are quite exciting and interesting.
Barbara was talking about thousands of software as a medical device or medical device that they are using AI in the US, approved. How the startup world can influence that? Because I'm sure that most of them, they are coming from a startup, and you were mentioning also the difficulties and challenge of the long development time, long sales cycle. How can a startup continuously improving, accelerating the use of AI in the healthcare sector?
Yeah, well, as a startup, you can focus, for instance, on specific pain points where other larger corporates maybe don't look at, and so with these niche areas where you can make something really well, you can iterate fast and integrate new technologies, new tools, and make them usable for healthcare professionals, for patients. So really to focus on that. And we see as well in Switzerland a lot of startups going more into reducing administrative work, for instance, by automatically summarizing and generating discharge reports, taking into account different sources to do that, and also with speech to text or speech to text into structured data. And I think there is a really interesting field, and Switzerland is I think on the forefront of that as well, with the startups and the startup ecosystem here.
Indeed, I can confirm also from my experience, great ecosystem of startup and that are enlarging more and more. Now I would like to move to Bram, to another aspect, let's call it in this way, that is about the staffing. So to have people that are knowledgeable, that they can help, they can influence and impact the healthcare. How is your opinion? How is your experience?
Yeah, so when I listen to the discussion about let's say technology, screening, I would have to say, okay, even with what we do today, we are already massively understaffed. And with an aging population, this is going to be even more pronounced in two ways. We will have more patients with multimorbid disease and less nurses and doctors to look at them. We are continuously explosively generating more data every year. So combine that with let's say less people to look at it. This is a very toxic combination. And then we rely on exactly those people to also give input on how it should work in medicine, but oftentimes also on annotating data. So I think we might be wise not to consider additional things. So I want to oppose a little bit to the screening idea, because oftentimes we screen with very low-tech tools compared to what we do in a hospital, and that just generates even more problems, especially of false positives, overloading an already overloaded system. On the other hand, nurses and doctors are spending more than 50% of their times in electronic health records today. But that's time they're not spending on looking at all this data in a clinical way, but just trying to find it. And so I think it would be very wise to use the technical efforts to free up this already precious time to do clinical work. And then we might also have some extra time for doing the work that we need to advance technology. I think it's really otherwise very risky to go on like this. And then the other thing of controlling costs, and I think you already said it a little bit, it's actually an emotional thing. Like, why are people not following therapies? Because they don't know what's going on, but also they feel like nobody explained it to me, or I don't like this doctor because he didn't have time for me. So medicine is a strongly emotional field, and if we don't have time, this will get lost and it will get more expensive. So my simple answer would be free up nurses and doctors, so that they spend time with their patients. That will be cost efficient, and they can work, let's say, with technology providers on building systems to really, free up the time again. So it's a bit of a circular argument, but I think that instead of adding new stuff that is not even approved, maybe we should concentrate on becoming more effective in what we are doing today.
Very interesting. I looked the organization. Do we have space for another question, maybe from the audience? One question from the audience. I mean, Bram mentioned about the patient and the empowerment of the patient today. I mean, we have access to social media, to Google, to ChatGPT, and we can learn more and more about the healthcare. I think this is also a challenge for a physician as well. That need to tackle such a knowledgeable patient that not always it is, because we have a bias on that. Do you have any question? Do you have any curiosity for the panelists? We are all involved in AI. Most of us is using already AFib detection in there. Yeah. The smartwatch. No question. No courage person. So I ask the same question to you, Bram. What about empowering the patient?
Yeah, so I think this is a huge chance we have, even though as doctors we might not always like it, but I think we have to learn as a profession to deal with it. But it, as you already alluded to a little bit, it requires very good information provisioning to a patient, especially if it's not supervised. So I don't want to use the argument that if it's not coming from a doctor, you shouldn't get it. I think that's totally wrong. And I think that's something we're looking at, is like, what if I have a very high quality database? How can I start representing things in a different way? Because I don't know your knowledge when you start asking questions. So basically deriving from your questions an appropriate way to represent the data, and then iteratively getting better in explaining you what's happening to you, and maybe also explaining to you what happens if you do this or that. So basically maybe even projecting patient trajectories, saying like, okay, if you would do this, this is a common trajectory of other people that have made the same decision. So to really make tangible the weight of some of those choices. And I think that's a huge opportunity from the combination of having good data and maybe chatbot-like systems to interact with that.
I would continue the discussion because it's so fascinating for me, but I guess we need to close here. Let me say thank you very much to everybody. Thank you to our panelists. Thank you.